everyone, Alexa here with NP2Go. A question that I've received about hormone replacement therapy: can it cause an increased risk for blood clots and or stroke? And there are two aspects to this. Oral estrogen, synthetic oral estrogen, has been linked to an increased risk of blood clots, but synthetic oral estrogen, which is something that we don't provide or we don't prescribe because we only deal with bioidentical estradiol. 17-beta estradiol is the estrogen that we naturally produce. That is going to be what is replaced. Using 17-beta estradiol does not increase your risk, whether it's pellets, creams, injection, or overall. Oral is the last route of estradiol that we tend to go to, just because there are increased risks with that over the other modality when it comes to specifically blood clots. However, that is really linked to the synthetic estrogen. We are being extra safe. Oral estradiol, that is truly 17-beta estradiol, is completely safe. The other thing can be related to testosterone. So testosterone replacement can increase your hemoglobin and hematocrit, which is erythrocytosis. And the way to treat that, go give a blood donation. However, that specifically does not mean you're at an increased risk for stroke or blood clots. That just means what we call sticky blood. There's actually no risk benefit with clotting issues, specifically with erythrocytosis. And that is what you would get, if anything, from bioidentical testosterone replacement. Do not get that confused with anabolic steroids that can have an increased risk of stroke and clot. Those are completely different things. And so sometimes bioidentical hormones such as estradiol and testosterone get a bad rep for synthetic issues that have happened in the past with all of our use of synthetic hormones before people realized there was either a huge issue or did not care. So please know that here at NP2Go, we are very cautious about our all patients, hormones specifically though, educating and letting them know what their options are. Overall, hormones are going to decrease your risk for high cholesterol, for stroke, for Alzheimer's, for breast cancer, prostate cancer. Bioidentical hormone replacement therapy can give all of those benefits. So just make sure you know the research, or you ask us if you have questions or concerns about any of these potential side effects or what you've heard in the past.